Today's topic is lateral epidondylitis. It is often referred to as tennis elbow, but tennis is not the only cause. Lateral epidondylitis occurs when you use the muscle that pulls your wrist up a lot, with the back of your hand facing up. In particular, ECRB and ECRL muscles often have problems, and there is pain in the tendon where the muscle attaches to the bone. The bone that protrudes outward from the elbow is called lateral epicondyle, and this is where the muscle begins. Pressing on this area is usually painful. The first causing factor is when you bend your elbow with the back of your hand facing up and use your hands a lot, you will use this muscle a lot. Second, it occurs when you do a lot of sports that use your wrist, such as golf or tennis. Some patients said they do not know why they have pain, even though they have never used their elbow before. However, in our daily life, for example, washing dishes, cleaning, grooming, ironing, laundry, vacuuming, etc., we use our hands with the back of our hands facing upwards. When you use the keyboard and mouse while working on the computer, you must keep your wrists pulled while using your hands. If you do lifting dumbbells or barbells with overhand grip, you will use a lot of muscles that extend your wrist. You will use your wrist a lot during golf and tennis. With treatment, the first and most important thing is to reduce as much as possible the movements that are causing and exacerbating the pain. Second, stretch and massage the muscle to make it flexible. By reducing the pulling force applied to the tendon, it can reduce damage. With the back of your hand up, straighten your elbow and pull your wrist down to stretch your extensors. In the same position, pull your wrist upwards to stretch the flexor muscles. For massage, find a muscle that is painful or hard and massage it along the muscle. If your hand hurts, you can use a ball. To prevent recurrence, wear an elbow brace about 4 centimeters below the elbow to reduce the transmission of pulling force to the tendon during golf or tennis. Taping along the muscle will help reduce the tension in the muscle. Third is strengthening exercises. It is recommended to do eccentric exercises, but in the early stage of severe pain, start with isometric exercises. Eccentric exercise refers to a type of exercise that sustains in an extended muscle state. We recommend 4 main types of exercise. First, we recommend dumbbell eccentric exercises. Eccentric exercises using a flex bar, band forearm supinator eccentric exercise, and hammer supinator eccentric exercise. The first dumbbell eccentric exercise. Grab a light dumbbell and pull the back of your hand upwards and lowering the dumbbell as slowly as possible to stretch the muscle. Eccentric exercises using a flex bar. Grasp the flex bar with the uncomfortable side. Hold it with the opposite hand and turn it clockwise. The flex bar will try to bend the uncomfortable side wrist, but hold it not to flex. Straighten your elbows out in front of you and slowly flex the wrist. Third, band forearm supinator eccentric exercise. Hold the band one side with the back of your hand down and slowly rotate your forearm so the back of your hand goes up. Hammer supinator eccentric exercise. Hold the hammer upright. Let it fall slowly in the direction of your thumb.